This is Amrita, and the topic that we'll be discussing now is breathing exercises. So, what are breathing exercises? See, firstly, breathing exercises are these set of exercises which actually help in improving the breathing technique. Okay, see, we have a number of respiratory disorders, and also there are situations where your lung needs extra assistance, maybe because of the underlying condition, or maybe say because of the prolonged bedridden period. Okay, so what these breathing exercises actually do is they'll actually improve the breath rate. Okay, they'll maintain your respiratory system, they will improve your respiratory system, they will clear out the secretions if at all the secretions are present, which usually in the respiratory conditions we see this formation of secretions. So if at all a patient has these secretions in their lungs, so in order to clear out these secretions also, the breathing exercises might be helpful. Okay, so there are like bunch of uses because of the breathing exercises. So besides this, in the field of physiotherapy, we have a lot of breathing techniques. Okay, we had bronchial hygiene techniques, we also had chest physiotherapy techniques, and also we have these lung expansion techniques. Okay, so we can actually incorporate the breathing exercises with all these techniques. Like you can incorporate the breathing exercises with ACBT, which is a bronchial hygiene technique. Okay, so I hope you're getting the point. So breathing exercises are these exercises which do not just maintain or improve the respiratory system, but they can also be incorporated with other techniques of respiration, and they can improve the lung function on an whole. Okay, so one more thing I just want to say is breathing techniques. When I say just breathing exercises, don't just think that these breathing exercises are only useful for maintaining the lungs or improving the lung function. Okay, there are conditions like, for example, say stress. Okay, people might be in stress, and in order to reduce this stress and to make the patient relaxed, not just a patient, anyone might feel stress. See, for example, if I'm assigned too much of work, even I get stressed. Okay, so in order to reduce the stress and make myself relieved, or maybe anyone to get relaxed, you can actually perform or ask the person to perform the breathing exercise, because it induces relaxation. The breathing exercises, they induce relaxation. So that's one more great advantage of breathing exercises. So why I'm stressing this, because there are conditions like post-traumatic stress disorder, wherein the patients feel so stressed because of some trauma which has already happened. The patients might feel very stressed. Okay, in such cases, one technique that actually helps them to calm down, to just come back to the conscious and feel relaxed, is breathing exercises. Okay, because they actually induce or they actually promote relaxation to the particular person. Okay, so that's something very important about breathing exercises. Okay, and besides that, as I've already mentioned, there are respiratory problems. Okay, there are n number of respiratory problems like formation of secretions, maybe, or maybe decreased lung volumes or decreased lung expansion. So in order to treat all these various like problems of the lung, you can actually use breathing exercises. Okay, and one more thing about the breathing exercises is, see, breathing exercises are not confined to one phase of breathing or respiration. Okay, see, respiration is a process which involves two phases, like it has inspiration and it has expiration. So breathing exercises are not a type of exercises which are like confined to either inspiration or expiration. You can actually treat a patient. See, if for example, let's just say there are few cases wherein the patient has only inspiratory problems and the expiration is completely fine. For example, the restrictive lung disorders. Okay, in the restrictive lung disorders, what happens is the patient feels this difficulty in inspiring the air, but however during expiration the patient doesn't have any problem. Expiration can be done very happily or normally. Okay, if we talk about the obstructive disorders like the COPD conditions, what actually happens in them is the patient feels difficulty to exhale, okay, or to expire the air. Okay, wherein there will be no problem with inspiration. So there are conditions which affect inspiration, and there are some conditions which affect expiration. So if a patient comes to you with a problem of inspiration, you can give breathing exercises confinedly for inspiration. Okay, and if a patient comes to you for expiration, you can actually give the breathing exercises for expiration itself. Or maybe if the patient has problem with both inspiration and expiration, that's a different scenario, and you can actually give the breathing exercises for both the inspiration and expiration. Okay, I hope you're understanding the point. The point what I'm trying to say over here is breathing exercises can be given for both inspiration and expiration. Okay, breathing exercises are not confined to one entity of respiration or breathing. Okay, remember that. Okay, these types are divided on basis of the various problems the patient might have. Okay, so based on the patient's problems, there are various types of breathing exercises. Okay, right. So firstly, we'll see roughly what these breathing exercises types are. Okay, so firstly we have diaphragmatic, we have diaphragmatic breathing, we have pursed lip breathing, we have segmental breathing, we have localized basal expansion, and lastly we have glossopharyngeal breathing. So these are the various types of breathing exercises, the 5 basic breathing exercises which are very important. Okay, so firstly we'll be talking about the diaphragmatic breathing. Now what is diaphragmatic breathing? So we all are very familiar with diaphragmatic breathing exercise. So diaphragmatic breathing exercise mainly like focuses on the diaphragm. See, diaphragm is the muscle which is very much important in terms of respiration. Okay, it's a primary muscle for respiration. Okay, so concentrating more on diaphragm is really, really important. Okay, so we'll see in detail how this diaphragmatic breathing is performed and what are the indications of this diaphragmatic breathing and how long can this diaphragmatic breathing be performed. Okay, so firstly, as I've mentioned, diaphragmatic breathing exercise mainly focuses on the diaphragm. Now, how does this diaphragmatic breathing actually work? If you want me to explain what diaphragmatic breathing is in a simpler terms, then diaphragmatic breathing is nothing like different from that of the normal breathing. It's just a deep breathing. Okay, it's normal breathing only, but you'll have to take deeper breaths. Now the question over here is, when it's like a normal breath, like normal breathing is taking place over here, like how is it actually helping the diaphragm to like expand, or maybe to the how is it actually promoting the function of the diaphragm? Okay, so what actually happens is, if you see a person normally breathing, like when I'm normally breathing, usually what happens, it's my chest that moves. Okay, the belly doesn't move. Okay, in the diaphragmatic breathing, one thing that you're supposed to see for is the movement of the belly. So how good is the belly moving is something you'll have to see in diaphragmatic breathing. Okay, now the question over here is this belly movement really important? Yes, it's really important to check this belly movement. This is because the greater the belly is moving, the greater the belly is expanding rather. That means that the diaphragm is that better being involved in the breathing exercise or the breathing pattern, whatever you're doing. Okay, so I hope you're understanding. See, normal breathing involves the movement of chest, wherein the diaphragmatic breathing involves the like deeper movement of belly. Okay, in the normal breathing also I agree that some amount of your belly will definitely move. Okay, that's physiological. But when you ask a patient to perform the diaphragmatic breathing, the belly moves so much. Okay, this is because the diaphragm gets involved completely, like it expands completely while performing the diaphragmatic breathing. Okay, so we'll see how this technique of the diaphragmatic breathing works. Okay, so when you say a patient to perform diaphragmatic breathing, firstly ask the patient to like place the patient in a comfortable position. Okay, see, the patient can sit while performing the diaphragmatic breathing, or maybe the patient can lie during the diaphragmatic breathing, like the patient can lie in supine position, or maybe the patient can sit in half lying position. Okay, the position of the patient doesn't actually matter, but the comfort of the patient matters. See, diaphragmatic breathing is a type of exercise which can even be performed in standing position, but will the standing position actually give comfort to the patient? Maybe after some 2 or 3 minutes, the patient cannot actually stand and perform the exercise. Remember the motto of the breathing exercise. Breathing exercises are not only given in order to increase your lung capacities or volumes, or maybe to clear out the secretions, but also breathing exercises can be prescribed to indulge or to induce relaxation. So when the patient is standing for a prolonged period of time, let's just say I've asked a patient to perform breathing exercise, which is the diaphragmatic exercise, for 5 minutes in standing. Will the patient feel comfortable? After 1 to 3 minutes, what happens is the patient will start to feel uncomfortable because of this prolonged standing. Obviously, there will be no more relaxation to the patient. Okay, so go for a position whatever is comfortable to the patient. So for example, let's just say if I want to just give this breathing exercise, the diaphragmatic exercise, to a patient who just got operated and maybe he's in some POD 1 or POD 2, the patient might not be very much comfortable to sit. Okay, after the surgery, the patient might not be able to sit very like comfortable, at least in on POD 1 and POD 2, the patient might not be very comfortable with sitting. So in such cases, I can actually ask the patient to go for supine position itself, and I can ask the patient to perform the diaphragmatic breathing exercise in supine position itself. I hope you're understanding the point. Diaphragmatic breathing can be done in various positions, and these positions, whenever you're like suggesting a patient a position to perform the diaphragmatic breathing, always remember that that position should be very comfortable to the patient, because end of the day, the exercise whatever the patient is performing should also give relaxation to the patient. Okay, that's something important. Okay, so that's about the diaphragmatic breathing. Okay, it can be performed in any position, right? Okay, now I have selected a position. For example, let's just say I have selected this supine lying position for the patient. Okay, now what should I do? Firstly, I'll have to place the patient in a very comfortable manner. Okay, I have adapted for supine lying. So now what I'll have to do, I'll have to place a pillow underneath the head of the patient. Maybe I'll have to place pillows underneath the arms of the patient, so that the patient will feel more relaxed. Okay, and give all the support the patient needs in order to maintain that supine position. Okay, take the help of sandbags or maybe pillows and make the patient feel relaxed. Now, after placing the patient in a comfortable position, okay, now what you'll have to do is, first of all, by comfort, I just want to mention something. Most of the patients will just go for this shoulders tightening. Okay, so make sure that the patient's neck and shoulders are relaxed while performing any breathing exercise. The neck and shoulders have to be very relaxed. Okay, right. So, okay, now the patient is completely relaxed. Now, what should we do? Now, after placing the patient in a very comfortable position, now the thing that we are supposed to do is, we'll ask the patient to place one hand on the chest. Okay, one hand should be placed up on the chest. The second hand is supposed to be placed on the belly. Okay, so when I say belly, do not assume that the hand has to be placed so down. Okay, it has to be placed just below your ribs. Okay, it has to like, the hand has to feel the movement of the diaphragm. Okay, the movement of, because of the diaphragm, your belly expands. So this movement has to be felt by the second hand. Okay, and one more thing to be remembered over here is, we are using two hands over here, right? One is being placed on the chest and the other one on belly, right? The hand that is being placed on the chest is completely immovable. It's a stable one. Okay, this hand doesn't move. Okay, but however, the hand that's being placed on the belly, that just below your ribs, this is movable. Okay, this will be mobile. Okay, so this hand is completely stable, it will not move, because in the diaphragmatic breathing, it's not the chest that we want to move, but it's the diaphragm, the belly, that's supposed to be moved. Okay, that's why the second hand, which is placed on the belly, will be moving so much. Okay, so that's how the diaphragmatic breathing, like the hand positions for the diaphragmatic breathing are to be placed. Okay, right. Now, okay, the patient is very comfortable. The hands, one hand is placed on the chest and other hand is placed just below your ribs. Now, what should we do? Now, you'll ask the patient to deeply inhale air inside, okay, through the nose. Okay, inspiration should be done through nose, deeply and slowly. Okay, there's no hurry, do not rush your patient. Make the patient breathe slowly. Okay, so once the patient takes in the air slowly and deeply with the nose, the expiration is supposed to be done through the mouth. Okay, the expiration will be done through the mouth. Inspiration through the nose and expiration through the mouth. Okay, this is a cycle, like you can ask the patient to perform this for 5 to 10 minutes. Okay, and also throughout the day, like multiple times also, the patient can perform this exercise. It doesn't have any like greater like contraindications or something like that. Okay, so the patient can perform whenever they want to, but make sure that the patient is not performing for a prolonged period of time, because deep breathing can actually strain the lungs. Okay, like the patient might feel fatigue, the lungs might feel fatigue. Okay, so that's why do not go for a longer periods. Instead, go for 5 to 10 minutes per each session, and go for multiple sessions in a single day. Okay, so that's how the diaphragmatic breathing is performed. So diaphragmatic breathing is a very important breathing exercise. This is because breathing control, if you know about breathing control is used in many other like techniques of respiration. Okay, so you can achieve breathing control with the help of diaphragmatic breathing, and also, as I've mentioned, relaxation. The relaxation can be promoted in a very better way through diaphragmatic breathing. See, there are different breathing exercises, I accept, and among these breathing exercises, diaphragmatic breathing is the breathing exercise which actually helps in achieving relaxation. Okay, and decreasing stress. Okay, so one more thing, while performing the diaphragmatic breathing, you can actually ask the patient to close their eyes depending upon the comfort of the patient. If the patient doesn't want to close their eyes, it's fine. But if they close their eyes, what actually happens is there will be this more what do you say, relaxation being increased. Okay, closing the eyes actually improves the relaxation. So that's something very important. Okay, so that's about the diaphragmatic breathing. So besides this relaxation, it also helps in clearing out secretions. Okay, some amount of secretions can be mobilized with the help of diaphragmatic breathing exercise, and also it helps in improving your lung capacities and lung volumes. Okay, that's really a good thing about diaphragmatic breathing exercise. Now the question is, how is this lung capacity is actually being increased? See, in the diaphragmatic breathing, we are confinedly using this diaphragm, like we are majorly using the diaphragm for breathing. So obviously, diaphragm is a very primary muscle or maybe a very important muscle for breathing. So when I'm using this major muscle for performing a breathing exercise, obviously what happens, the capacity will increase of the capacity of the breathing will increase. I hope you're understanding. So for breathing, we use multiple muscles. Okay, multiple muscles are involved for inspiration and expiration. Of course, I accept that. But among which diaphragm is the major muscle. Okay. Now here for breathing, I'm confinedly going for diaphragm. Like I'm using diaphragm for the major part, for the most part rather. Okay. Now what happens? Obviously, when the major muscle is being involved so much, what happens? Obviously, the capacities will increase. The capacities of lung will increase, and also the alveolar ventilation will increase. This is because once the capacities and the volumes are being increased, obviously the oxygen that's being sent into the alveolar level will also increase. So obviously the alveolar ventilation will also increase. So once the alveolar ventilation is increasing, what happens, the blood oxygen levels are also increased. Okay, because it is the alveoli which actually is the site where the gaseous exchange takes place. It's not, so lungs constitutes of n number of parts. So in these parts, it is the alveoli where the gaseous exchange takes place, right? I hope you all remember the basics. Okay, see, if this is the blood capillary and if this is the alveoli, what actually happens, this constitutes of oxygen. Okay, whatever the oxygen that we have inspired, it goes to the alveoli. Okay, now the alveoli constitutes of the oxygen. Now what happens, the vessel, this constitutes of deoxygenated blood wherein there is no oxygen. Now what actually happens, this alveoli which constitutes of the oxygen, what they do is this will transfer this oxygen into this deoxygenated blood, and the carbon dioxide whatever is present in this deoxygenated blood will enter into the alveoli. This is the basic physiology what we have learned in our first year. I hope you all still remember it. Okay, so the alveoli constitutes of the oxygen, and this oxygen from the alveoli will enter into the blood capillaries whatever constitute of the deoxygenated blood, and the carbon dioxide whatever is present in this deoxygenated blood will enter into the alveoli. That is the gaseous exchange, the basic gaseous exchange. Okay, so once the alveolar ventilation increases, obviously what happens, the blood oxygenation also increases because the alveoli has more oxygen to provide to the blood. Okay, I hope you're understanding, right? And one more advantage of the diaphragmatic breathing exercise is it helps in fighting against the PTSD, post traumatic stress disorder. Okay, so if patient has some post traumatic stress, then actually in order to decrease this stress, you can use diaphragmatic breathing, as it like improves a lot of relaxation. Okay, that's the uses of the diaphragmatic breathing. Okay, now coming to the indications of diaphragmatic breathing, what are the indications of diaphragmatic breathing? There are many indications of diaphragmatic breathing. Like for example, say atelectasis. Atelectasis is a condition wherein the diaphragmatic breathing will be very useful because it's a restrictive condition, okay, wherein the inspiration is a problem. As I've already mentioned, for the restrictive disorders, you can actually go for diaphragmatic breathing and segmental breathing because they help in better inspiration. Okay, they'll improve, they'll strengthen the inspiratory muscles and they'll actually improve this inspiratory rate. Okay, so in terms of atelectasis, you can actually go for diaphragmatic breathing. Besides that, even for COPD, you can go for diaphragmatic breathing. Okay, besides the atelectasis and the COPD, you can also suggest diaphragmatic breathing to the patients who have neuromuscular problems. Okay, wherein the respiratory muscles have become weak. Okay, in such cases also you can go for diaphragmatic breathing. And other conditions involve like sleep apnea. In terms of sleep apnea, you can ask the patient to go for diaphragmatic breathing, and also surgical cases. Okay, If a patient has undergone surgeries, particularly to the thorax or maybe the abdominal areas, you can actually ask the patient to go for diaphragmatic breathing. This is because, see, what happens post-operatively, particularly if a patient is operated to the thorax or abdomen, what actually happens is the patient will be in a great pain. So whenever the patient is going for breathing, they'll feel this pain, and because of this pain, they'll go for shallow breathing. Okay, so shallow breathing is always a risk. This is because, see, breathing is very essential because through inspiration, we are achieving this oxygen into our body, and through expiration, we are sending out all the carbon dioxide which is present in our body, right? So, once the shallow breathing takes place in the patient, once the patient starts to breathe shallowly, what happens is this breath or the oxygen that's being taken in and the carbon dioxide that's being sent out will like vary. Okay, like the oxygen that the patient is taking in will be decreased, and the carbon dioxide which the patient is supposed to send out. So what actually happens is, because of the shallow breathing, when the patient is taking, like when the patient is inspiring the air, what happens, the amount of oxygen will decrease. Okay, now once the amount of oxygen decreases, what happens, the alveoli do not have enough amount of oxygen to deliver it to the capillaries. Okay, now the blood cannot be oxygenated properly. In the same way, coming to the expiration, because of the shallow breathing, what happens is the carbon dioxide will not be completely sent out. Okay, some amount will stay in the lungs itself. Okay, now what will that lead to? That will lead to hypercapnia, which is increased carbon dioxide. Okay, so that's really very important. So in order to eliminate this shallow breathing, you can actually ask the patient to go for diaphragmatic breathing, because diaphragmatic breathing helps in achieving this deep breathing. Okay, so shallow breathing can be eliminated with the help of diaphragmatic breathing. So that's one more indication of the diaphragmatic breathing. Okay, right. So that's all about the diaphragmatic breathing.